The thyroid gland is a small butterfly-shaped organ located in the front of the neck, directly under the larynx. It is part of the endocrine system and is responsible for the production of hormones that regulate many important functions in the body, including metabolism, heart rate, body temperature, and energy levels. The thyroid gland produces two main hormones. Thyroxine, T4, is the main hormone that contains 4 iodine atoms. It affects metabolism, cell growth, and body development. Triiodothyronine, T3, is the active form of thyroxine containing 3 iodine atoms, which controls many processes in the body, such as body temperature, energy levels, heart function, and digestion. Both hormones are regulated by the pituitary gland through the hormone thyrotropin, which in turn stimulates or suppresses the production of T3 and T4, depending on the needs of the body. Thyroid diseases and their symptoms. There are several thyroid diseases that can lead to an imbalance in hormone production. Hypothyroidism is a condition in which the gland produces an insufficient amount of hormones. The main symptoms are chronic fatigue, a set of weights, feeling cold even in a warm environment, dryness of the skin and brittle hair, depression and memory problems, slowing down the heart rate. Hypothyroidism is an increased activity of the thyroid gland, in which hormones are produced in excessive amounts. Symptoms include palpitations, I will lose weight without changes in the diet, excessive sweating and a feeling of heat, nervousness, anxiety, irritability, trembling in the hands and muscle weakness, sleep disorders, autoimmune diseases. Hashimoto's thyroiditis, the immune system attacks the thyroid gland, which leads to its destruction and, as a rule, the development of hypothyroidism. Symptoms are similar to hypothyroidism, but may also include an enlarged gland, goiter. Graves' disease is an autoimmune disease in which the immune system stimulates the thyroid gland, causing hypothyroidism. Symptoms include bulging eyes, exophthalmos, as well as acute signs of hypothyroidism. Nodes and goiter. Sometimes nodes may form in the thyroid gland, or its volume may increase, which leads to the formation of goiter. This condition can be accompanied by both hypo and hyperthyroidism, as well as be asymptomatic. Regular examinations, including hormone tests and ultrasound examination of the thyroid gland, help diagnose diseases at an early stage and prevent their development. The thyroid gland plays a crucial role in regulating metabolism, growth and development of the body, and its diseases can greatly affect the quality of life. Thyroid disorders, such as hypothyroidism, insufficient hormone production, or hyperthyroidism, excessive gland activity, can cause a wide range of symptoms, from fatigue and weight changes to heart problems and psycho-emotional instability. However, proper treatment and compliance with certain lifestyle restrictions can significantly improve well-being and prevent deterioration of the condition. In this video, let's look at what not to do with thyroid diseases and what habits can worsen the patient's condition. Neglect the advice of an endocrinologist. The first and most important thing not to do with thyroid diseases is to ignore visits to a specialist. An endocrinologist is a doctor who helps diagnose and monitor the functioning of the thyroid gland. He prescribes the necessary hormone tests and selects the optimal treatment based on the individual patient's indicators. What happens if you neglect visits to the doctor? Uncontrolled course of the disease can lead to serious complications. The appearance of symptoms such as fatigue, weight changes, depression or irritability may be associated with thyroid disorders that require medication dosage adjustments. The lack of monitoring of hormone levels can lead to the development of crises. Thyrotoxic with hypothyroidism or myxodematous with hypothyroidism. Independently cancel or change the dose of hormonal drugs. Many patients with thyroid diseases take hormonal medications such as levothyroxine, which helps maintain normal hormone levels. Self-withdrawal of the drug or a change in dosage can lead to serious consequences. Why can't the dosage be changed without a doctor's recommendation? When the dose is reduced, the symptoms of hypothyroidism may worsen. Drowsiness, weight gain, memory and mood impairment. If the dose is increased, hyperthyroidism may develop, which can cause palpitations, anxiety, weight loss and trembling. Abrupt withdrawal of the drug can cause hormonal disruptions that will be difficult to fix. Eat foods containing excess iodine. Iodine is an important element for the normal functioning of the thyroid gland, as it participates in the synthesis of its hormones, thyroxine and triiodothyronine. However, both a lack and an excess of iodine can negatively affect health. What should not be consumed with an excess of iodine? A large amount of seaweed, fish, and other seafood. Dietary supplements with iodine. Use iodized salt in food without controlling the level of iodine in the body. Excess iodine can provoke the development of hyperthyroidism, especially in people predisposed to thyroid diseases. If the doctor does not recommend increasing iodine intake, it is better to limit the use of iodine-containing products. To consume foods containing goiter substances. Goiter substances are substances that can inhibit the synthesis of thyroid hormones and contribute to an increase in its volume. Goiter. These substances are present in some foods, and consuming them in large quantities can worsen the condition. Products containing goiter substances include cabbage of all kinds, broccoli, cauliflower, turnips, radishes, soy products, soy milk, tofu. People with hypothyroidism or other thyroid disorders should limit the consumption of these products, especially in their raw form, since heat treatment partially destroys goiter substances. Neglect weight control. Weight and metabolism are closely related to thyroid function. With hypothyroidism, metabolism slows down, which can lead to weight gain. With hyperthyroidism, on the contrary, metabolism accelerates, and a person can lose weight, even with a normal appetite. Why is it important to control weight? Excess weight in hypothyroidism may increase the risk of developing cardiovascular diseases and diabetes. Drastic weight loss in hypothyroidism can lead to nutritional deficiencies and weakness of the body. To maintain a healthy weight, it is important to follow a balanced diet and exercise regularly, but at the same time avoid too intense loads. Ignore the symptoms of stress. Stress is a serious factor that can worsen the course of thyroid diseases. Constant psycho-emotional stress affects the endocrine system and can cause changes in hormone levels. How does stress affect the thyroid gland? Stress can trigger an exacerbation of autoimmune diseases, such as Hashimoto's thyroiditis or Graves' disease. An increase in the level of stress hormones, cortisol, can reduce the activity of the thyroid gland, which leads to increased symptoms of hypothyroidism. It is important for patients with thyroid diseases to include relaxation techniques such as meditation, yoga, and breathing exercises in their lives to reduce the negative effects of stress. Abuse alcohol and caffeine. Alcohol and caffeine can negatively affect metabolism and worsen the symptoms of thyroid disease. Although their effect on the gland itself is not direct, they have an indirect effect on hormonal balance and overall health. Why can't you abuse alcohol and caffeine? Alcohol can enhance the side effects of hormone therapy and impair liver function, which is important for thyroid hormone metabolism. Caffeine can cause palpitations and increase anxiety, which is especially dangerous in hyperthyroidism. It is better to reduce alcohol and caffeine consumption to a minimum, and with hyperthyroidism, their complete exclusion is possible on the recommendation of a doctor. Neglect physical activity. Despite the fact that intense physical activity may be undesirable for patients with thyroid diseases, complete lack of physical activity is also contraindicated. Regular moderate exercise helps to maintain weight, strengthen the heart, and improve overall well-being. What can't be done? Completely eliminate physical activity from your life. Overload the body with intense workouts, especially with hyperthyroidism. Light forms of exercise such as walking, swimming, or yoga are recommended, which help maintain muscle tone and promote normalization of metabolic processes. Thyroid diseases require a careful and comprehensive approach to treatment. Compliance with the restrictions and recommendations of the doctor helps to control hormone levels, maintain overall health, and avoid serious complications. It is important to understand that self-treatment, uncontrolled use of drugs or products, as well as ignoring symptoms, can lead to deterioration of the condition. Regular visits to an endocrinologist, a balanced diet, moderate physical activity, and care for the psycho-emotional state are key components of successful treatment of thyroid diseases.